Good morning, esteemed guests, colleagues, and partners. It is truly an honor to welcome you all to this significant milestone, the official launch of the Hearts Initiative. Today marks an important step forward in our collective commitment to strengthening cardiovascular health, enhancing hypertension management, and improving patient outcomes within our primary healthcare system. I extend a special welcome to our distinguished speakers and representatives from PAHO WHO, the Ministry of Health, and St. George's University, as well as to all the healthcare professionals, policymakers, and stakeholders who have played a vital role in shaping and implementing this initiative. Your dedication and collaboration have been instrumental in bringing us to this moment. As we officially introduce Hearts to Grenada, let us recognize that this is more than just a program. It is a commitment to saving lives, preventing complications, and ensuring standardized evidence-based care for all. With the support of PAHO and the Ministry of Health, we have already made great strides in establishing hypertension registries, implementing treatment protocols, and preparing educational materials to guide healthcare providers and empower our communities. Today is not just a celebration of our progress, but a call to action. Let us continue working together to ensure sustainability, monitoring, and continuous improvement as we integrate Hearts into our healthcare system. Once again, welcome. I look forward to a meaningful and productive engagement as we move forward in this journey toward better heart health for all. At this time, we would have the opening prayer by Mrs. Camille Isaac, our Chief Pharmacist. Let's welcome her as she comes.
Thank you. Good morning, all. May we stand for prayer. Almighty God and Father, Creator of us all, we thank you so much for your love and your blessings towards us. We thank you for bringing us here safely today. We ask, Lord, that your Holy Spirit would come upon us and would give us the inspiration as we resensitize on this initiative, the Hearts Initiative, whereby we help in the management and strengthening the care given to our population in dealing with this condition, cardiovascular condition. We ask your blessing upon each of us, and we pray, Lord, that our meeting here would not just be a meeting, but we each would be reinvigorated in the fight to help improve the health of our population. We thank you for your blessings, and we thank you for all that you have done and what you will continue to do on our behalf. We ask with thanksgiving in Jesus' name. Amen.
You may have your seat. Thank you, Mrs. Isaac. At this time, we would have the overview of Hearts in a few brief remarks by Dr. Sean Charles, our Chief Medical Officer.
Good morning, esteemed guests, both from Ministry of Health, all our local organizations, local stakeholders, and from the team that is visiting us from the Pan American Health Organization. I would like to also extend my welcome to everyone who is viewing this national public launch of the Hearts Initiative. Now, I am very cognizant of the fact that I am actually sitting in a room or standing in a room with persons who are far more versed or far more qualified to speak on the Hearts Initiative because I know that the Pan American Health Organization has been championing this throughout the region. And we are just one more country to implement this program. But nonetheless, I'll provide a brief overview of the initiative. So, PAHO WHO Hearts Initiative, this is an effort that is led by WHO PAHO to improve cardiovascular health by strengthening the prevention and management of hypertension and other cardiovascular risk factors in the primary care setting. It is aligned to the Sustainable Development Goals and the WHO Action Plan for Non-Communicable Diseases. Now, the Hearts Initiative aims to reduce the burden of cardiovascular diseases, particularly hypertension and related complications. Now, in the Grenada context, the last survey that we had, the Heart survey, was quite some years ago. That survey showed that over a third of the population is walking around with elevated blood pressure levels. And this is quite concerning. And we see the effects of this in the high rates of admissions to hospital for the complications. Now, it also aims to improve primary healthcare services to better prevent and manage hypertension and other risk factors. It integrates evidence-based standardized treatment protocols for hypertension, and this is quite important in our context as well, because what we have observed is that high blood pressure is basically treated based on where you studied, and that has been the experience locally. If you studied in this country, you treat hypertension this way. If you studied in that country, you treated it another way. This initiative aims to standardize the treatment of high blood pressure and cardiovascular risk factors in an evidence-based and standardized manner. It also promotes task sharing and team-based care and enhances the efficiency of healthcare delivery. It also improves access to essential medications and technologies. We have already procured the medicines that form part of the Hearts regimen, the Hearts protocol in Grenada, and it is available in the public healthcare system to our patients. And also strengthens monitoring and evaluation, because this is an important component of the program in itself. Now, Hearts is implemented in a series of modules, and the modules actually follow the acronym HEARTS, where H stands for healthy lifestyle, which includes, diet and exercise and tobacco cessation and reduction in alcohol consumption, etc. The E means evidence-based treatment protocols, which I just spoke about. The A stands for access to essential medicines and technologies. The R and the technologies also includes access to and recommendations on validated blood pressure measuring devices. So not every device that is used to measure the blood pressure is actually validated, meaning that it actually gives you an accurate reading. All right, so the Hearts regimen, there's also a recommendation for which devices to be used, and there's also training on how blood pressure should be measured accurately. All right, then the R stands for risk-based management, all right? Risk-based management, and this is shifting from single disease approaches to cardiovascular risk assessment. The risk assessment is also part of this initiative. The T stands for team-based care, all right? This enhances the importance of the role of all of the members of the healthcare team, the doctors, the nurses, etc. And the S stands for systems for monitoring. And as I mentioned before, monitoring is an important part of the initiative. Now, you might ask, why the Ministry of Health has embarked on the adoption of this initiative at this time. The Ministry of Health at present is in the midst of revitalizing and enhancing the primary healthcare services that are delivered to the public. Some of the more visible activities that may have been observed in some of our main clinics where the demand is greater, you would have noticed that we have added additional physicians to make services more accessible. But the adoption of evidence-based approaches for treatment is also a key pillar in our efforts to strengthen the primary healthcare drive. All right? Because we recognize primary healthcare as the cornerstone of the healthcare system. All right? Primary healthcare is the cornerstone of the healthcare system. Primary healthcare is where the majority of the population should receive their care. We do not desire for anyone to go to the hospital because often persons arrive at the hospital when their condition is quite at an advanced stage where there is little that can be done. So we want to make basic and essential health services accessible as far and wide as possible. We want there to be a reorientation towards prevention and early detection as opposed to what obtains in many instances right now. So the increase in the screenings and education and all of this is included as part of our efforts to strengthen primary health care. And of course, our primary health care team provides a comprehensive range of services. We don't just treat sick people that walk through the door, all right? Education is an important component, but we also have the routine screenings. We have maternal and child health services, which includes vaccinations and all of these. All of these are important elements of the system as well. Now, this is where we expect, as I mentioned before, the bulk of the population to receive most of their care. And we would like to arrive at a point where because of the relationship that has been developed between the patient and their primary healthcare facility, all right, and the confidence that is built, that the continuity in that patient's care will be assured, because there is a tendency now for individuals when they're sick to go directly to see a specialist, and in most instances this happens in the private sector. This is very expensive and ineffective care. The expectation is that an individual's first access point to receiving health care should be their primary care provider, who will then refer that individual in an organized manner to a specialist where necessary. All right? This avoids duplication and it avoids unnecessary expense for persons in the population. So it is a more cost-effective approach. And for all of this, we have to engage the community, we have to educate, we have to do more. But this is the path that we've embarked on because we have recognized the benefits, which were inherent in everything that I mentioned before. So I say this in a nutshell so that you understand why we're here and where we're going. So thank you very much.
Thank you, Dr. Charles, for providing a concise overview of the Hearts Initiative, highlighting its critical role in primary healthcare and the importance in strengthening cardiovascular health and improving hypertension management in Grenada. At this time, we would have some brief remarks from Dr. Darlan Noel, Internal Medicine Specialist, Co-Chair, Department of Clinical Skills, and the Associate Dean of Clinical Studies at the St. George's University.
Pleasant good morning to everyone, and I think Dr. Charles' summary spoke for all of us. And I must say that listening to Dr. Charles, I know that we're headed in the right direction. Now, the launch and most importantly, the subsequent implementation of Hearts Initiative in Grenada is a significant milestone for us. We're going to see the implications way down the road. Many of our regional counterparts, like Trinidad, St. Lucia, Dominica, Barbados, have already implemented Hearts. The importance of today can never be emphasized enough. We know that NCDs, non-communicable disease, cardiovascular disease, hypertension, strokes, heart disease, together with other diseases like cancers, diabetes, which is a coronary artery disease equivalent, contribute, and chronic lung disease as well, contribute to 74% of all deaths worldwide. And believe it or not, 73% of all of these NCD deaths occur in low and middle income countries. And of all the NCDs deaths, cardiovascular disease is the leading cause. My dear colleagues, treating and having better management of cardiovascular disease like hypertension in the primary healthcare setting is going to significantly reduce cardiovascular risk and morbidity and mortality in our population. And I'm speaking from where I stand for the last 26 years as an internal medicine specialist. We cannot emphasize enough the importance of today. What I want to point out is that guidelines and protocols for managing hypertension in primary healthcare are crucial because they provide a standardized approach to identify, assess, and treat high blood pressure, ensuring a consistent quality of care, minimizing complications from untreated hypertension, and ultimately improving patient outcome by reducing the risk of cardiovascular events like stroke and heart disease. We see many patients coming into tertiary healthcare with disabling strokes, hypertensive emergencies, end-stage renal disease, the cost of treatment which is astronomical, and it's not readily available to all of our population. Today, I want to impress on all of us that the Hearts Initiative is an intervention that will improve hypertension and cardiovascular disease management in the primary healthcare setting. Now that we have a standardized approach and it is well validated, it is up to us to ensure that all patients with hypertension receive similar quality care regardless of whether they seek treatment or where they seek treatment, be it in the public or the private healthcare setting. Standardized protocols and guidelines have been shown to improve patient outcomes, and the guidelines are evidence-based. Our policymakers have to support the initiative by ensuring a consistent supply of those essential medications necessary for implementation. And having a standardized protocol also provides a metric for quality assurance. We have the guidelines, we have the protocol, we can do our evaluation periodically to evaluate adherence to those guidelines and ensure that all our patients receive proper care. The guidelines do not only help identify individuals at risk for hypertension, but prompt initiation of treatment protocols is going to prevent a lot of morbidity and mortality because it allows us to intervene with evidence-based guidelines before the complications set in. And my remarks is only brief, but I want to point out to you that the implementation of the HEARTS program in our primary healthcare setting is going to significantly reduce the burden in our tertiary system, our single 200-bed hospital, where every day someone is admitted with complications of hypertension, be it heart disease, cardiovascular disease like strokes, heart failure with preserved ejection fraction, heart failure with reduced ejection fraction, hypertensive bleeds, too much to mention. And this intervention, we cannot underscore the importance of that. We just have to ensure that everyone, as I said, publicly and privately, adhere to those standardized, well-validated protocols. And in our country, we're a little bit unique because this is the first country where I see gynecologists providing primary health care and all of that. So it's important for us to ensure that the guidelines reach everyone who provide primary health care. And as Dr. Charles emphasized, primary health care should be the start, not tertiary health care, because it's a continuity. It is not a single encounter, and it's not a single event. And as I close, I would quote one of my dear friends, my dear colleagues, and she said to me a couple of weeks ago, this patient came to her for follow-up, and they were discharged from hospital with a blood sugar of 200. They came in for elevated blood sugar, what we call hyperglycemic hyperosmolar state. And I had to explain to her that, yes, the hospital treated the complication. The hospital initiated a regime, but get rid of the mentality that the job of the hospital is to provide primary care. The patient is now discharged back to you to provide continuity and to manage her. You cannot expect the tertiary institution to keep them there for 3 months to monitor the A1C and to adjust the medication. So we have to get people in the mindset of the importance of primary health care. And I want to end by thanking Dr. Renaud and team for the excellent job that they have done in making today a reality. And I am telling you, we're going to see the benefits when all of our providers in the public and private system implement evidence-based treatment protocol for management of our patients. Less people presenting for the first time to hospital with end-stage renal disease, less people presenting to hospital with disabling stroke and inability to provide for their family, less people presented to hospital with heart attacks, ST elevation, MI that we have no ability to treat in our current settings. The benefit is tremendous. And today is one of the happiest days in Grenada in my medical career.
Thank you, Dr. Noel, for creating context on how important it is for us Being considered a lower middle income country to implement this initiative hurts, especially into our primary healthcare. Your insights emphasize the need for standardized, evidence-based strategies and protocols to improve hypertension management and overall cardiovascular health in our healthcare system. At this time, we would have some brief remarks from Ms. Taraline Malcolm, Advisor, PAHO WHO. Thank you.
Thank you, Madam Chair. Mrs. Kim Taylor, Permanent Secretary, Ministry of Health, Dr. Sean Charles, Chief Medical Officer, Dr. Dolan Noel, Internal Medicine Specialist and Co-Chair for the Department of Clinical Skills and Associate Dean of Clinical Studies for St. George's University. Thank you for that excellent opening remarks. I heard you were awarded with an award of achievement for your contribution to healthcare. So that is excellent. Thank you so much, Dr. Noel. Dr. Carriacou Renard, Senior Medical Officer and Director of Primary Care, members of the PAHO and Hearts team, distinguished guests, members of the media, ladies and gentlemen, good morning. It is truly an honor to be here today as Grenada takes this critical step in addressing the growing burden of cardiovascular diseases by introducing the Hearts Initiative. I bring warm greetings on behalf of PAHO WHO representative for Barbados and the Eastern Caribbean countries, Dr. Amalia Del Rego, who sends her regard and best wishes for a successful launch. As Dr. Noel mentioned and Dr. Charles spoke to, the high burden of NCD as a leading cause of death and disability in the Caribbean and worldwide. Cardiovascular diseases in particular account for a significant portion of the burden, driven by the risk factors such as hypertension, diabetes, and of course, our unhealthy lifestyle choices. The Global Hearts Initiative offers a set of proven, effective interventions aimed at strengthening existing health system. So that's one of the key takeaways, that Hearts is there to strengthen what already exists. And in the region of the Americas, more than 33 countries are currently implementing the Hearts Initiative. And over half of those countries are here in the Caribbean. So the initiative focuses on improving blood pressure, diabetes control, promoting healthier lifestyle, and reducing risk factors, which are critical steps towards reducing premature mortality and improving overall health outcomes. So Grenada's decision to adopt the Hearts Initiative represents a major milestone in strengthening primary health care and ensuring that prevention and management of cardiovascular diseases remains a national priority. These efforts align closely with our regional commitments, and I want to highlight two of those recent commitments or events that took place. First, in 2023, we all gathered in Barbados for the Small Island Development States Conference on NCD and Mental Health. And that meeting served as a platform for countries like Grenada to share challenges and solutions in tackling NCD and mental health, reorganizing our unique and recognizing, our unique vulnerabilities. Coming out of that meeting, we have the Bridgetown Declaration on NCD and mental health, which emphasized the urgent need for integrated, resilient system that prioritize NCD prevention and management as essential to national development. More recently, we had the 4th International SIDS Conference, which was held in Antigua and Barbuda, where NCD took a center stage. We had a dedicated side event for NCD, which looked at underscoring the need to scale up action, recognizing that NCD is not just a health problem, but is a major social and economic concern. The discussion highlighted the importance of regional collaboration, strong policy implementation, and community-level interventions, all of which are central in the Hearts Initiative. So Hearts serve as a foundation for the Better Care for NCD initiative, which reinforcing the need for integrated, people-centered approaches. By applying lessons from the Hearts Initiative, we are well positioned to continue offering better care for NCDs. We aim to create a seamless and robust health system that enhances prevention, early detection, and effective management of NCD. So PAHO remains steadfast in supporting the Ministry of Health, healthcare providers, community partners in ensuring successful implementation and sustainability of the Hearts Initiative in Grenada. Our shared goal is to build a health system that is responsive to the needs of all, particularly those at the highest risk for cardiovascular diseases. So in closing, I commend the Ministry of Health leadership and commitment to this initiative. I also extend my deepest gratitude to all healthcare professionals and stakeholders that are involved in this process. Your dedication and hard work will make a tangible difference. Dr. Noel spoke about the other countries in the Caribbean that have already started the implementation of the initiative, and they are reaping the results of this. So I am commending you for your step in the process at this point in time, but I'm also encouraging you to remain steadfast in its implementation, because you will see the reduction in strokes and heart attack. You will see the reduction in the complication from diabetes and hypertension. And as I mentioned, the Hearts Initiative is a foundation, it's a central point that you can build on for your other NCD, because in many cases we're asked, why is it that we're spending so much effort on hypertension and diabetes? And of course, the data shows the high burden that these two conditions has. But it also allows us to apply the lessons from the Hearts Initiative to our cancers, to our chronic respiratory illnesses and so forth. So it's really taking the lessons from the Hearts Initiative and applying it across the board. But of course, based on our small size, based on our limited resources, we have to prioritize. And by prioritizing, we're putting the emphasis on those that we know if we're able to make a dent, if we're able to make a difference, it will be significant. And that is the reason we're starting with hypertension and will scale up to diabetes, and then, of course, move to the other condition. So I thank you for having PAHO here this week, and we remain committed to supporting the Ministry of Health to advance the health and well-being of the people of Grenada. Thank you.
Thank you, Ms. Malcolm, for your words of encouragement and for highlighting the strides of hearts in the region, and for PAHO WHO's unwavering support and commitment to advancement in our healthcare system here in Grenada. At this time, we would have a feature address which would be done by our PS, Ms. Kim Taylor. Can we invite her as she comes?
Distinguished guests, representatives from the Pan American Health Organization, management and staff of the Ministry of Health, healthcare professionals, ladies and gentlemen, good morning. Warm greetings from the government of Grenada. It is an honor to stand here before you today at the public launch of the Hearts Initiative in Grenada. This event today represents a pivotal moment in our collective fight against non-communicable diseases, which remain among the leading cause of death. The burden of NCDs weighs heavily on our healthcare system. It affects individuals, families, and communities, and by extension, national productivity. In Grenada, we face an increasing prevalence of hypertension, diabetes, and other cardiovascular conditions. These conditions are responsible for significant morbidity and mortality, straining our healthcare system and limiting the potential of our people to lead healthy and fulfilling lives. Addressing NCDs is not just a health priority, it is a national development imperative. Today, we reaffirm our government's unwavering commitment to strengthening primary healthcare and integrating the HEART initiative into our national healthcare framework. We pledge to work assiduously to ensure better care for NCDs. We recognize that effective management and prevention of NCDs require a multifaceted approach involving early detection, standardized treatment protocols, and the promotion of healthier lifestyles. This is why we are prioritizing policies and programs that focus on prevention, early diagnosis, and the delivery of care to all citizens. Through the HEART initiative, Grenada aims to enhance its hypertension management efforts by implementing evidence-based strategies that involve blood pressure control and reduce cardiovascular risk. We will expand the initiative to include the management of diabetes in the coming months. We will ensure that our healthcare providers are equipped with the necessary training, resources, and tools to offer high-quality patient-centered care. We have added the essential medication to our HEART hypertension treatment algorithm to our national formulary, and they are already available at our public dispensaries. Furthermore, we are committed to strengthening data collection and monitoring systems to track progress and improve decision-making. We recognize the vital role of technology in improving healthcare. Digital health tools, particularly the DHIS2, has been instrumental in transforming data collection and analysis within the Ministry of Health. DHIS2 enables real-time disease surveillance, trend monitoring, and informed decision-making, ensuring interventions are targeted and evidence-based. Our goal is to build an accessible, efficient, and responsive healthcare system by equipping providers with the necessary tools and training. In our endeavor for digital transformation, leveraging digital health tools further enhances data-driven policymaking, resource allocation, and overall healthcare delivery. We also recognize the importance of multi-sectoral collaborations. Tackling NCDs effectively requires the involvement of various stakeholders, including the private sector, civil society, and the community at large. We will continue to foster partnerships that encourage healthier environments, promote physical activity, and support the reduction of harmful lifestyle risk factors such as unhealthy diets, tobacco use, and excessive alcohol consumption. The Government of Grenada extends its deepest gratitude to PAHO, our team at the Ministry of Health, and our partners who have worked tirelessly to bring this initiative to life. Your expertise, support, and commitment to improving healthcare in Grenada are valuable. As we launch the HEART initiative in our country, we do so with great optimism and determination. This initiative is not just about managing hypertension. It is about transforming our healthcare system to better serve our people. It is about ensuring that every Grenadian, regardless to your socio-economic background, has access to high-quality, preventative, and life-saving care. To achieve our objectives, we will be placing emphasis on key areas. These include expanding screening programs to identify high-risk individuals early, enhancing community-based health intervention to support lifestyle modifications, strengthening medication access to ensure adherence to treatment, increasing public awareness campaigns to educate individuals on the importance of health care, collaborating with local and international stakeholders to ensure sustainability of our efforts. Additionally, we will be encouraging schools, workplaces, and community organizations to promote heart-healthy behavior from an early age. Our young people must be equipped with the knowledge and tools to lead healthier lives, thus preventing the onset of NCDs in the future. Ladies and gentlemen, we must all work together to ensure that our communities are healthier, our families are stronger, and our people can lead longer, more productive lives. The time for action is now. The government of Grenada stands ready to lead this charge, and we will call upon every stakeholder to join us in a mission to reduce the burden of NCDs and build a healthier future for all. Once again, I thank PAHO for their unwavering support. Together, we can make a lasting impact and change the health trajectory of our nation for generations to come. Thank you, and may we continue to walk in unity towards a healthier, brighter future.
Thank you, PS, for your remarks on the way forward for us as a ministry to ensure the sustainability of the program and to ensure that our call to action, that it ensures the burden of NCDs are reduced and our people will live healthier lives. At this time, we will have the vote of thanks done by Ms. Rachel Roberts, our Senior Administrative Officer at the ministry.
Mrs. Kim Taylor, Permanent Secretary, Ministry of Health, PAHO representatives, Dr. Sean Charles, Chief Medical Officer, other distinguished guests, ladies, gentlemen, media. It is my pleasure to extend our thanks and appreciation to all those who contributed to this launch this morning. I first want to thank our Honorable Minister, Philip Telesford, for his leadership and support for this initiative. Although he is not present here this morning, we know that he is behind this initiative 110%. We want to thank our Permanent Secretary, Mrs. Kim Taylor, for her remarks here this morning and for the leadership and support that she has demonstrated to the Ministry of Health and the team, Dr. Reno and her team, with this initiative. P.S., we thank you. We want to thank our committed partners, the Pan American Health Organization, led by Dr. Amelia Del Rego. We want to say a special thank you to them and all the representatives who took the time off to be present here with us this morning. Ms. Starlene Malcolm, who gave brief remarks. We want to thank you, Ms. Malcolm, for your remarks and for providing us with the overarching holistic benefits of what Hearts Initiative is all about and how we as a country and a region we can take the lessons learned from other islands to improve and in the provision of healthcare and reduce the burden of non-communicable diseases on our society, especially hypertension. We want to thank you for those remarks. We want to also thank our Chief Medical Officer, Dr. Sean Charles, who did an excellent job in enlightening us about the Hearts Initiative, and more importantly, educating us about the reasons for the Hearts Initiative to improve primary health care and save lives. Thank you, Dr. Charles. I want to also thank Dr. Donald Noel, Internal Medicine Specialist, Co-Chair, Department of Clinical Skills, Associate Dean of Clinical Studies, St. George's University. His presence here this morning demonstrates the support and the commitment that we have with St. George's University for being with us in this initiative. His remarks also solidified the significant value of Hearts to Grenada and its importance to strengthen primary health care and demonstrates the support of the St. George's University to the Hearts Initiative. Dr. Noel, thank you. Behind every great initiative, there is a great person, and that great person is no other than Dr. Carriacou. And we want to say a special thank you to her and the Heart Steering Committee for leading this initiative and for bringing us to this stage here today that we can actually launch Hearts. Dr. Reno, a special thank you to you and your team. Take a bow. I want to thank, without God, we are nothing. And so I want to thank Mrs. Camille Isaac, who invited the Lord's presence here with us this morning to bless this initiative of the launch and to ensure that we are in safe hands, having God's blessings. Thank you, Mrs. Isaac. To all our stakeholders here in the room and those who are not present here with us, those who are listening online, I want to say a special thank you to all of you for your participation in this initiative, for your presence here, those who are here with us, those who are listening online, for taking the time off to listen. And I want to thank everyone for coming here today. Grenada is now in good hands with the Hearts Initiative. Thank you all.
Thank you, Ms. Roberts, and thank you for being here today. At this time, we are supposed to have a promotional video.
The Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the Hearts Initiative.
At the core of the Hearts Initiative is the Hearts Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of Hearts has introduced a standardized approach to the way we manage high blood pressure patients.
The Hearts protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the Hearts program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The Hearts Protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond the primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concerns that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice. And we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that we ensure that that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using as part of the HEARTS initiative, they're somewhat designed to be less burdensome on the patient because the number of pills that the patients would be required to use to control their conditions are reduced, because now we are making use of combination therapy. So one pill will contain maybe your 2 high blood pressure medications that you're taking at present.
Medication that are available through the HEARTS initiative heavily subsidized, right? Patients that are less than 60 would pay a small fee. Those who are over 60 and over, it would actually be free as per a protocol that already existed.
Following the introduction of the HEARTS initiative, we anticipate better compliance among our patients. We anticipate a reduction in the number of individuals who have uncontrolled high blood pressure. And at the end, we anticipate that in the long run, a reduction in the number of complications and the number of deaths that we are seeing as a result of high blood pressure and cardiovascular disease.
Thank you. So this has brought us to the end of the opening ceremony and official launch of the HEARTS initiative here in Grenada. Thank you for coming, and we know that the sessions thereafter would be productive ones. Thank you.
For those who are remaining,